Edo State Governor Senator Gov Okpebholo has flagged off free malaria testing, treatment and distribution of malaria drugs to combat the surge in the state. Governor Okpebholo was accompanied by his deputy, Right Honorable Dennis Dahusa, Coordinator, Office of the First Lady, Edesile Enaini Okpebholo, Secretary to the State Government, Barrister Musa Ihalo, Chief of Staff, Gani Awodu, Permanent Secretaries, health officials, partners of the program, among others. The governor said malaria is a major health challenge and his administration is determined to eliminate the disease in the state.
Our goal is to eliminate malaria in Edo State. This support from Islamic Development Bank will help us achieve that, and with my commitment to affordable healthcare. Over the next 2 years, we aim to ensure 80% of pregnant women receive malaria prevention medication. 2, 95% of the people with fever for malaria. 3, reduce infant death caused by malaria to below 10%. To make this happen, malaria testing and treatment will be free at all government hospitals. And clinic in Edo State. However, we need everyone's support. While free testing and treatment are in place, raising awareness is key. We will run campaign to ensure everyone knows about these services. Also, anyone caught charging for these free services will be disciplined accordingly. I sincerely appreciate Mr. President Asiwaju Bola Ahmed Tinubu, GCFR, for his commitment to better healthcare, the Islamic Development Bank for its funding and support, the Federal Ministry of Health for its guidance. With our combined effort, we will achieve a malaria-free Edo State.
Coordinator, Office of the First Lady, Edesile Enaini Okpebholo, commended the Okpebholo-led administration for taking the laudable step in ensuring the people enjoy good health care. She noted that as easy and simple as malaria appears, it is deadly, even as statistics shows that 30% of citizens of the state are exposed to it, adding that the state has taken steps to fight and drastically reduce it.
First of all, today I want to tell you that we're here to kick and knock malaria out. As you said, it's the first in the state. It's to let you know that this administration is open to everything good. And yesterday we added another name to the governor. We said it's Akbako Healthcare. So as it affects the citizens of Edo State, anything healthcare, we're in for it. Malaria, as common and as simple as we tend to make it, is a deadly disease. And from statistics, we heard today that Edolites have 30% of malaria. And we're saying we can drastically reduce it. To our women, we're saying embrace this initiative. We're saying that malaria affects more women and children. We're here to make sure that our children live healthy. So we say what the government has done today with the partners, it's a good initiative. Embrace it. Mosquito nets, keep your surrounding clean. We have the malaria testing kits. Once you feel the symptoms of, well, fever, sometimes it's not malaria. Just don't go for the testing. It's free. And we'll emphasize, it should not be so.
The Commissioner for Health, Dr. Cyril Shomule, said the program is all about free malaria testing and treatment, which is sponsored by Islamic Development Bank.
Free malaria treatment and testing sponsored by Islamic Development Bank. For the next 2 years, all government hospitals in Edo State will receive patients and treat them for malaria and testing free of charge. No health worker should charge any patient for malaria treatment and testing, at least for this first phase, for the next 2 years. So thank you.
Sir, there are fears that some health workers will use the guise of antibiotics to charge patients while treating malaria. Are there specific kind of antibiotics that will be attached to the malaria drugs that will be given to them?
Well, the question is a very technical question. The patient comes with the malaria symptoms. If you are treating for malaria, it's a different ball game. If you are treating for other infection, it's different. You know, infectious disease is broad spectrum. It can be of many symptoms or other diagnosis. But for the diagnosis of malaria, it's free. It doesn't mean that If you have typhoid, it's going to be free. Whereas this particular on malaria, testing and treatment or management.
Director General of Edo State Health Insurance Commission, Mrs. Augusta Ikpehi-Enaholo, said the commission is in alliance with the program, ensuring every Edo State citizen is given affordable and free access to malaria medication.
Yes, as the DG Edo State Health Insurance Commission, we are aligned also with this program that just took place, and we are happy that this has happened. The mission for this program is to ensure that every Edo State resident is given affordable and free access to malaria medication. This is a pandemic, and the governor has spoken that he's mandated to ensure that everybody in Edo State is free from malaria, and it's going to be free of charge.
In Government House, Benin City, Faith Dibier reporting for Afrima Reporters TV.